Hello and welcome to Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with developments the world over, in the region, and of course here in Zimbabwe. Now this show is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. I am Owen Kaura. And as always, we start by taking a look at the latest COVID-19 statistics released by the Ministry of Health and Child Care. 192 new cases of COVID-19 were recorded from 5,432 COVID-19 tests conducted yesterday. Now, this represents a 3.5% positivity rate, taking the number of active cases to 7,766. 3 deaths were recorded, bringing the cumulative number of fatalities to 4,416. The cumulative number of COVID-19 cases now stands at 124,773, and of these, 113,057 are recoveries. And Zimbabwe has currently 156 hospitalized cases of COVID-19, and of these, 20 are new admissions, 21 are asymptomatic, 86 are mild to moderate cases. 21 of those admitted have severe symptoms, whilst 28 are in the intensive care unit. And that brings us to Zimbabwe's ongoing vaccination program, where 30,132 people received their first dose yesterday, bringing the cumulative for the first dose to 2,582,705, while 17,035 received their second dose to bring the cumulative for the second dose to 1,636,498. Now, the Minister of Information, Publicity and Broadcasting Services, Monica Mchangwa, gave a summary of the state of the country's vaccination program. She said the government is expecting another shipment of vaccines today, donated by the Serbian government.
In the nation, that is of 30 August 2021, a total of 2,552,573 persons had received the first dose of the COVID-19 vaccine, while 1,619,463 persons had received the second dose. This translates to a national coverage of 29.7% and 18.9% for the first and second dose, respectively. Vaccination in border towns, other hotspots, and people's markets is progressing as scheduled. The initial 15,000 doses of the donated 30,000 Sputnik V vaccine by the Serbian government are expected tomorrow, 1st September 2021. Cabinet wishes to inform the nation that, owing to the tremendous support and acceptance of the vaccination program by the churches, government has launched Operation Mara, where the churches can now call on government vaccination teams to vaccinate members against COVID-19. The launch of Operation Mara will drive and accelerate the vaccination program towards attainment of a herd immunity.
Now, authorities in Zimbabwe also say they are on high alert in the wake of reports of a new COVID-19 variant that has been detected in neighboring South Africa. And according to researchers, there are concerns about the new COVID-19 variant C12. Chief Coordinator of the COVID-19 response in Zimbabwe, Dr. Agnes Mahomva, says local experts are also monitoring the new variant while pushing the vaccination program to achieve herd immunity.
Prevention measures do not change at all. We have always been aware that viruses mutate. We have always known that viruses mutate and we will get new variants. And so our preparedness response approach does not change. We are very prepared. The same prevention measures apply to any variant. The vaccines that we are not just there to prevent, to protect people from getting the virus, but they also protect individuals really too from being hospitalized and from death for any variant at the moment. So we are very happy. We will continue strengthening our response.
And of course, yesterday, Zimbabwe announced the resumption of sporting activities. They called on all supporting staff and officials to be vaccinated. Information Minister Monica Mchangwa recommended that children aged between 14 and 18 involved in sport be vaccinated.
All local activities in which the participants are below the age of 14, that is in sports, they shall, in all cases, be checked for COVID-19 symptoms, have regular temperature checks, and follow all the social distancing protocols. Athletes or children aged 14 to 18 years are highly recommended to get vaccinated, and the National Sports Association can work with Sport and Recreation Commission to get this done.
But naturally, hesitance on the vaccination of children and adolescents is to be expected. Will parents and guardians heed the call, or are we likely to witness a slow uptake as we saw with the vaccination? In any case, we should trust science. The president of the Pharmaceutical Society of Zimbabwe, Portia Mwendera, has commended the government of Zimbabwe for extending the vaccine to the 14 to 18-year age group, saying that the vaccine is safe.
Based on the science currently, I think it's a good move because it's weighing the risk and the benefit that comes from vaccinating the adolescents. I think what we've seen of late is that the adolescents are actually we are having the infection rate going up in the adolescents. True, adolescents usually do not suffer as much as the adults because comorbidities are a bit lower in the adolescents, but they also transmit this to the elderly population. So getting them vaccinated would reduce the infection rates in the whole population.
And that's it on Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with developments the world over in the region and, of course, here in Zimbabwe. The show is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. I am Owen Kaura. Stay safe.